Hello everyone, welcome back to my channel. So today we will discuss about the regions of abdomen. The regions of abdomen are theoretically divisions used by clinicians to help localize, identify and diagnose a patient's symptoms. There are two main forms of categorization. The first, which is simpler and is mapped out by dividing the abdomen into 4 quadrants, while the second method divides it into 9 segments. So, the 4 quadrants are right upper quadrant, right lower quadrant, left upper quadrant and left lower quadrant. And the 9 region scheme is the 2 vertical mid-clavicular lines cross 2 horizontal subcostal and transtubercular line. The 9 segments are right and left hypochondrium, epigastrium, right and left lumbar regions, umbilical region, right and left inguinal regions, hypogastrium. So, coming to right upper quadrant, the right upper quadrant contains the right lobe of liver, gallbladder, pylorus of the stomach, first 3 parts of duodenum, head of the pancreas, right kidney and right suprarenal gland, distal ascending colon, hepatic flexure of colon and right half of transverse colon. Right lower quadrant contains majority of the ileum, cecum and vermiform appendix, proximal ascending colon, proximal right ureter. And left upper quadrant contains left lobe of the liver, spleen, stomach, jejunum, proximal ileum, body and tail of the pancreas, left kidney and left suprarenal gland, left half of transverse colon, splenic flexure of the colon, superior part of descending colon. The left lower quadrant contains distal descending colon, sigmoid colon and left ureter. Depending on the sex of the individual, both the left and right lower quadrants contain part of the urinary bladder and uterus for females, as well as ovary or uterine tube and ductus deferens for male. The right and left hypochondric regions are found superiorly on either side of the abdomen, while the epigastric region sits between them in a central, superior position. The right and left lumbar regions surround the umbilical region, which is central and has the umbilicus at its center point. Lastly, the right and left inguinal regions are found inferiorly on either side of the hypogastric region, which is the most inferior of the central line of segments. Left hypochondric region contains stomach, top of the left lobe of the liver, left kidney, spleen, tail of pancreas, parts of small intestine, transverse colon, descending colon. Right hypochondric region contains liver, gallbladder, small intestine, ascending colon, transverse colon, right kidney. Coming to epigastric region. The epigastric region contains esophagus, stomach, liver, spleen, pancreas, right and left kidneys, right and left ureters, right and left suprarenal glands, small intestine and transverse colon. The position of transverse colon can differ slightly from person to person due to its mobile suspension within the transverse mesocolon. It is, however, usually located between the epigastric and umbilical regions of the abdomen. So coming to left lumbar region, it contains portion of small intestine, part of descending colon and part of left kidney. And right lumbar region contains inferior most part of the right lobe of liver, gallbladder, small intestine, ascending colon. Umbilical region contains stomach, pancreas, small intestine, transverse colon, right and left ureters and cisterna chyli. And coming to hypogastric region contains small intestine, sigmoid colon, rectum, urinary bladder, right and left ureters, ureter, right and left ovaries and uterine for females, and in males ductus deferens, seminal vesicles and prostate. So this was a short description about how we divide the abdomen into 9 regions. I hope you found this video useful, and if so, please do like and share this video, and also if you want to see more videos on this channel, make sure to subscribe. Thank you so much for watching this video.